irregularities because of exam. Menstrual irregularities is coming from hormone changes that is related to the stress of the exam. So sometimes it naturally reverts back to normal. Sometimes they may need a little bit of push in the right direction. Again, we need to diagnose at these times to see whether it's okay or not. Normally, a couple of months of irregular menstruation is normal. If you ask me, I will tell them to wait for a while, take some natural supplements to keep your body healthy, reduce stress, okay? And if after 2 months or 3 months the period is not coming back to normal, then you need to check on your hormones. Without checking the hormones, just doing an ultrasound scan is again is not the correct way, in my humble opinion. Because if you are just looking at the effect, you're not looking at the cause. Okay, the uterus is changing and the ovary is changing because of the hormones. Okay, and if you don't look at hormone tests to know what is causing it, then how can you treat it? You don't know the cause. So whatever treatment you are taking is just cutting the grass on the top. You're never pulling out the weeds. So it will keep on happening at the same time. So you need to recognize and accept that it might be a hormonal problem. Again, during early working life, many women undergo career changes, they get married, they get stressed, same issues can happen. Again, they have to be alert to that fact. And of course, we are going on to middle 30s and 40s. To my knowledge, if I test every woman out there, 35 years roughly, okay, if I test them for their hormones, most of them have some issues with their hormones. But it's just not a accepted or recognized fact, because not everybody is willing to take action on it. Okay, not everyone is brave enough to go out and say, look, your hormones are wrong and we may need to treat you. So this is something you may want to understand, and keep looking at it when you're doing your yearlies. Ask for some hormone tests to be added in. It will give you a lot of good feedback in the way you age, in the way you avoid fibroids or ovarian cysts or weight gain or hair loss or whatever other things that we mentioned right now. Of course, when we are going on to menopause, of course, myriad number of problems. And when is menopause starting? Menopause is not starting just after your period finishes. There is a condition called perimenopause, and that's around the time of menopause. A lot of hormones change, and this happens almost from 45 on to 55. This is a very dangerous period of time in a woman's life, and she needs to be extremely cautious. Every year is a must to have a proper blood test, including all the hormones. It's important to have a proper breast examination, a pap smear. It's important to check yourself and vaccinate yourself for any kind of HPV related disorders in the cervix. It's also important to test yourself on cancer markers as well during this time. So this is the dangerous period, and if we don't do an ultrasound, we may miss a fibroid or a cyst. If we don't do your hormones, again, like what I mentioned, we don't know what is causing these lumps, what is causing the breast lumps. We want to prevent rather than just do chop chop, surgery to remove it. What is the point of fixing something if it's already broken? We want to try to not break it in the first place. Human body is so intricate, but at least God has given us sufficient brains to be able to recognize some of it, and we should use it. Okay, so and then of course after postmenopausal, after menopause, now women live up to 83 life expectancy. So there's still a long way to go. You want to preserve your bones, you want to preserve your joints, you want to preserve your mental acuity. Okay, you want to make sure you still are mobile and active, and you are wise figure for your whole family and for the community, because at that time there's a lot that you can do to help the community, because you have the wisdom and you have the power to be able to give your power to people who are with you. So there's a lot of things that hormones can do, and so we need to recognize it as important.
Okay, Doctor, you were mentioning a lot about how we can detect all this, but I'm just wondering, how is the hormone tested? And could I do like a home test kit? Is there an available kit, or do we have to come to the clinic to actually get this done?
I don't suggest any home kit at all. The reason being that even if you could do a simple home test kits, the interpretation is what is most important, you see. So even if you were to just test the most expensive test, for example, at a center, where it's offered, still the doctor who's going to look at it and help you, assist you to understand your results, and then do some positive, correction or prevention of whatever is happening to you at that time, then it is completely not useful at all, if you ask me. But to go to what kind of blood tests, what kind of tests we should do, we have over time, because I started treating hormones for prevention aspects about 20 years back, okay? Because I've been doing anti-aging, well-being and cosmetic medicine for more than, I think, around close to 30 years, of which 25 years is my own practice. And we started by doing saliva testing, we started by doing, hair testing, hair bulk testing, urine testing. Though for certain specific testing, urine tests I still do use. Like we want to know a comparison between the good hormone levels to the bad hormones, because that is both, okay? So we need to, especially estrogens, I do a lot of correction for fibroids and ovarian cysts using a ratio between the good estrogens and the bad estrogens. So then I would need a urine collection sample over 24 hours, and then we will do a testing on that for the ratios. But other than that, the most reliable one, and then the most convenient one for everyone concerned, and which can overall give you a good idea, will be still a blood testing. And I'm not talking about a home kit test where you just poke you in the fingertip, okay? Those are capillary blood. It can alter for anything, even with a small temperature change, humidity change, it can change. And hormones are amino acids, and they're very fine protein chains, okay? So they can easily be altered at this kind of pressure. So it's venous blood, okay, taken. And of course, when we interpret it, we need to know whether it was taken in the morning or in the evening, because most hormones have their dips and their peaks and their valleys. So we need to know at what time we are testing it. And for female who are still menstruating, having cycles, we also need to know what part of their cycle we are testing their female hormones, like estrogen, progesterone, luteinizing hormone, stimulating hormone. We roughly need to know which part of the cycle. Is it immediately after period? Is it during period? Is it mid-cycle? Is it just before period going to come? We need to know the time. So during history taking, we will be doing all this. And for me, my hormone testing at my center that we conduct is never complete unless we do a full, interview process. An interview process is how we're not going to be able to sit down and able to talk to you for 4 or 5 hours to find every nook and cranny of your life. So what we do is we give you questionnaires. This is very important, because this is how you feel, okay? So with that, and it's a very thick questionnaire, so you need to complete that, and then the blood test reports will be there in front of me, and I will also do a physical examination. And the physical examination, to me, if you're still you're still ovulating, or you're just postmenopause, we need to make sure that we have done a proper scan, or check on your breasts, on your uterus, on your ovaries. Because if we were to introduce female hormones to you, we need to make sure we are not treating you with a fibroid sitting there, or a cyst sitting there, or even a cancer sitting there, you see. So we need to be making sure that we have checked all of this. So 3 important things: physical examination, most of the time with ultrasound scan, or in special conditions even mammogram, and of course we need the blood test.